Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're going to be talking about a really important topic, the healthcare cloud. And our special guest is Cheryl Rodenfels. She's CTO and Healthcare Strategist at Nutanix. Welcome, Cheryl.
Hi, John. Glad to be here today.
Yeah, so I'm excited to dive into our topic, but before we get there, tell us a little bit about yourself and Nutanix.
Well, I've been with Nutanix about 2.5 years, and before that, I was a CIO at a large healthcare system in Chicago, as well as a chief technology officer at a hospital in San Diego and one in Dallas.
Wow.
And the really fun thing is, I'm a former Nutanix customer as well. I joined Nutanix to help start the healthcare vertical because we provide invisible infrastructure, and what that allows organizations to do is create their own on-premise cloud. And especially with healthcare organizations and really other organizations that are a little cloud hesitant, they like the
Hmm.
idea of Nutanix being able to provide an on-premise cloud so that they get to learn how to operate as they were in a public cloud, and it also gives them that modern technology that they were looking for.
Awesome. Sounds good. So, we can't have a conversation these days without some mention of COVID, I think. So, as you look at the environment and, what your customers have done, where has cloud and healthcare really shined during COVID-19 and where has it maybe been an issue?
So those are two really good opposing thoughts for the most part. Um, where it's really shown is when people had to move home quickly, when they
Mhm.
had to expand their telehealth reach, when they had to, there was just so much uncertainty. They really enabled their use of cloud technology, both private and public, because they had to flex up quickly. A lot of the jobs in hospitals were designed to work for people to work at their desks in a department. Now, they had to turn on a dime and quickly get people home. Well, the way that they're set up is their internal network was set up for the majority of the people, and their external network for much smaller population. They had to switch it. So, in
Yeah.
order to be able to expand that capacity, their cloud technologies allowed them to expand that real quickly. And now, what they're finding is how to adjust that between how many people are really staying at home with more healthcare professionals vaccinated. Are they coming back? So they're really balancing it. So that's where it's shown. Now, the challenge has been for companies that weren't used to metering their usage.
Hmm.
All of a sudden, after month one, they were hit with a pretty big bill. So that invoice comes that first month, and there's sticker shock. So really, what they had to do is learn how to uh, manage that way more quickly than they probably otherwise would have.
And I think that is the fear for many CIOs or CTOs is this going to be really expensive if I go to the cloud? What's kind of your response to that as far as the potential cost ballooning and how do you, what would you suggest to a CIO to make sure they manage that effectively?
Well, this is always a time for a good plug, and that is if you have a tool that helps manage the cost and it helps predict the cost, then you can not guess, you can predict ahead of time where to put that application and that data. So, for example, we have a tool called Beam, and what it does is it helps you figure out the characteristics of the application and where is it most cost effective to put the data, as well as what usage you're going to see. So for example, if you have something that's very database intensive, that, like, let's say active imaging, which everybody scans everything, they scan your
Yeah.
ID, they scan your driver's, like, the ID card for your
Yep.
insurance. That is done for every single transaction. All of a sudden you have this big, you know burst of data. That's where you're going to run up the bill. Now, if you have something that is a little more static, that is, a little more regulated instead of dynamic, well, then you can predict what that cost is going to be every month. So that's really a little more appropriate for cloud use if you want to keep your operations, um, within a certain tolerance of spend.
Yeah, and I think that seems like it's the key is understanding, is the application going to be accessing the data all the time, or is it just store it and forget about it? You may request it later at random intervals, but it's not something that needs to actively be accessed. Kind of like, I love the MRI images or imaging, right? Often you take it, you do the read, and then you probably don't look at it again ever, or or at least maybe not for a few years.
It's interesting that you talk about imaging too, especially as a lot of the imaging systems, they're on DICOM standard. But the thing is, we stored them in file storage like we did every other thing, like Word documents and uh, other just regular storage. Now we're able to take those DICOM images and we're able to apply them to object storage and treat them more like unstructured data. So they take up
Uh-huh.
less storage space. And object storage is really what the public cloud the public cloud providers use, and it really makes it more efficient to store that data. So now you don't have rows and rows and rows of storage arrays in your data center. You can actually use something like the public cloud because you can manage those more effectively. And at the same time, you can actually inspect and put intelligent tags on that data. It's awesome, and providers are really liking using that object storage instead of regular file storage.
Yeah, and it's interesting to compare that against some of the cloud solutions for things, to enable COVID vaccination, COVID testing, all of that. What's been your experience? I mean, my feeling is if we didn't have cloud, we wouldn't be able to do these remote sites, right? Like, or it would be much harder. What have you seen, as far as the use of cloud and in enabling the COVID vaccination, COVID testing, et cetera?
Well, I have a really good story. My husband went to get his first vaccination on Monday, and he drove out to this little town. We are in Texas, but because of how things were allocated, it's about 30 miles from here. He
Okay.
drove into this long driveway. It's a senior center, um, and all of a sudden, he's in these lanes of traffic as if he were going to a concert. It was that
He wishes it
awesome.
was a
Oh,
concert or a football game, right?
absolutely. But they had everything measured out. But his comment, it was just perfect. He said the amount of tablets, the amount of people, and the amount of checking data between the time he showed them his QR code that they had to scan to allow him to go through the line, and then they checked his information at 3 other places. That's all done through scanning and visual inspection, but they have to check it into their tablets. Hospitals use tablets internally, a lot of times for rounding, a lot of time for quick notes and things like that. But this massive rollout of tablets away from the mothership, out at this remote location in the middle of Waxahachie, Texas,
Uh-huh.
um, it was effective, it was quick, and he said by the time he finished his vaccine, from start to finish, he was there 25 minutes. But
Mhm.
from start to finish, by the time he was sitting in the post-shot waiting room, his next appointment showed up in his patient portal for
Wow.
him. So being out there, and again, we're not talking. You're talking about a place that we can hardly get a cell signal on most days as you drive through there, but it
Uh-huh.
was that effective and that efficient. And this particular provider had to scale up and had to scale quickly. That is not their only center. They have 6 or 8 centers just like that. Are they going to be there forever? Probably not. That's why they like the cloud and they're able to get that out there quickly. And when they're done, they can ratchet it back down.
Yeah, that makes sense. Not a single server on site, I'm sure,
No,
in
no, it's in a
that
senior,
area,
it's in a
but it makes
senior
sense.
center where they, it's a big common room where they have events, meetings, they have performances and things like that. It's not set up for IT.
Yeah. It's interesting. I think it was a half a dozen years ago. I was sitting in a CIO event, a focus group kind of thing, and this amazing female CIO said, "Well, I don't want to use the cloud, but I have to." And I was like, "It's so fascinating that she realized, one, that we have to, which I think is the reality today as well. But how do you see that evolving? And what do you think a CIO should be doing as they try to manage not just the cloud, right? Which is kind of a nebulous term that I think, advertising has made confusing, right? But there's private clouds, there's public clouds, there's the hybrid cloud. How should a CIO, kind of look at this, and when should they use each? How should they approach that?
Well, it's this is what we work on all day. This is what we work on with our customers. I'll tell you, we run something called an Enterprise Cloud Index survey, and I'll tell you that 70% of global IT leaders who responded to our 2020 survey said that COVID-19 has actually caused them to be more strategically aligned with cloud technology and move it into their organization.
Hmm.
But with that said, um, what they're doing is they're redefining and working with their comfort of the technologies. So I'll give you an example. For things that really aren't as risky or things that they're willing to take a chance on. So, for example, if they have to spin up a new research study, no, it doesn't have, it has anonymized patient data in it. It has no impact to production applications at the hospital. They're really more willing to use public cloud for those sorts of things because if something were to happen, the risk to the hospital really is minimized. So um, that they're willing to try and get it going. And it also allows the researchers, physicians, clinical staff to do some of these things on their own, a little more self-service instead of waiting in line for months of
Yeah.
IT funding and get behind project 52. So that's something that they're willing to try. The next thing that they're all doing is they're using software as a service. That again is another cloud, right? So whether it's their EHR that they're transitioning to a hosted environment, or really most of them are using their financial platforms, their ERP services, whether it's PeopleSoft or Infor,
Mhm.
those are both now being hosted because what they're finding is they don't have team members who still have those skill sets, and the people that provide those services are really good at it. So instead
Yeah.
of them saying, let me hire a whole bunch more, let's do more software as a service. And you see that in collaboration, whether it's Office 365, Nuance, the voice recognition system.
Right.
If I don't have to have it and those guys can provide it and it interfaces with all my other applications, I'd rather have it as a service. So they're using that. So now we have public cloud, we have that as a service. Now let's talk about, their traditional data center environment where they'll have a mix of things like our hyperconverged infrastructure for that on-premise cloud, plus they have traditional and very legacy applications because
Sure.
healthcare doesn't like to get rid of anything,
6-year
before it's
retention.
time. So all of a sudden, we just described a multi-cloud environment between public, as a service, on-prem, and legacy. They've got a little bit of everything going on. So it's not that they can escape it, and it's not that they're dreading it. It's the right solution for the right purpose and the right technology. They line that up and say, where do I see the fit, and what is the best option for our organization?
Yeah. Well, I think we were all shocked when she said it 6 years ago or whatever, because even then it was shocking. Now, I think when people are finally understanding, we need to understand this and understand the right fit, kind of as you described. But I think also one of her fears that, I think she shared later as well was kind of around security. But I've seen an evolution. I'd love to hear your thoughts on this, where it used to be, oh, cloud is less secure because I can't see the device and all sorts of things that don't really actually make sense, right? What have you seen as far as security? I'm seeing more and more people saying, actually the cloud's more secure because they're more professional than, or I can't keep someone with that expertise to keep it. What are you seeing with your customers?
John, I see a little bit of that, but what I see more is that the cloud providers and people like us, we build security into the platform, so it's integrated. You don't take a
Mm,
separate product and you bolt it on, and we work with
gotcha.
everybody else's technology. But what they've done instead, I really think it's kind of flipped, and it is more secure because they're using modern tools like AI for prevention and detection and to help with recovery. So these are things that we used to have to do manually in our data centers. If I'm going to protect something, I have to go figure out I need an antivirus product, I need a firewall, many
Yeah.
firewalls, and all of these things required continual updates and continual management. But a lot of your cloud products and a lot of your modern security products, they use those AI and machine learning attributes, and they actually perform a better defense so that you really can get a zero trust environment. And that's what the cloud provider is moving for. He says, I want zero trust, because wouldn't it be a shame that for some reason, if one of these bad actors got into your application and you're in the same data center,
Yeah.
through your cloud provider as 10 other people, and it just starts wiping out people's full businesses. That
Yeah.
they don't want that. And
That's a
so they
problem.
protect against it, and that's what they've done to protect it. Now, what we had to do in healthcare is you have to align that with your compliance department that says, I have a checklist, a security checklist, and
Sure.
your solution, whether it's a cloud product or a hard product or any kind of application, it has to meet these compliance, you know, uh, features, and you have to be able to protect, HIPAA and the security rule and all those other good
Sure.
things. And as long as it meets or exceeds it, we're very comfortable. And then some organizations are, they're asking for money back guarantees, and they're asking for a risk sharing. If
Interesting.
it happens, you're going to help pay the breach uh,
Sure.
fees and
The
fines
insurance
and
and
those
stuff.
sorts of things. So hold them accountable, right, for not having security, or you don't want to put it there, but really make them share the risk of you putting your workloads in their hands.
Yeah. It's fascinating to see how quickly that's evolved. But what a great point that they're incorporating and embedding the security features, which is very different than if you do it in house, where you have to bolt on other solutions. So that's great. Is there anything about cloud that people just don't understand? Any things that you're like, yeah, I have these conversations a lot, and it's surprising that you're still having to explain about cloud that they should really understand?
Um, what we see, and this is a pretty good trend. A lot of organizations are bringing non-healthcare folks in as CIOs and in as CISOs, and they adopt a very quick and bold cloud-first strategy. The
Uh-huh.
challenge in healthcare is a lot of the applications are not written for the cloud. They
Hmm.
are really written for client server. We've had to learn how to virtualize them through the various tools, whether it's hyperconverged infrastructure or some of our old virtualization methods. Uh, but the problem is you can't just lift it out of your existing environment and plop it in the cloud and say, go get them.
Yeah.
It really is a transition. And a lot of the healthcare application vendors have not written their applications for the cloud yet. So I would say it's great. Come have a cloud first mentality if it means you want to be agile, flexible, you
Hmm.
want to have all those good operating behaviors that the cloud allows you to have. Um, but don't forget, we're working with technology where a lot of times the vendors did very proprietary things because they made it harder for you to switch to another vendor. So for
Yeah.
you to change, not even to just upgrade, but for you to change to a whole different technology, that's a way different investment, and it's a way different set of skills. And that's what I would say is one of the big challenges. And it's also one of the things you have to understand. You hate to say, well, healthcare does it different. But I can tell you at my last organization, I had 600 applications
Yeah.
and not a single one of them was cloud ready.
Wow. Yeah, I mean, let alone, if you spend a few hundred million on your EHR or 11 billion in some cases,
Yeah.
you're not swapping it out. You're going to stick with it, even if it was developed back in 1979, right? So very interesting. Well, Cheryl, this has been really insightful. I appreciate you sharing these insights, and thanks everyone for watching. If you want to find more great health IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Cheryl.
Thanks, John.